Welcome to the Risky Healthcare Business Podcast, where we help you prepare for the future by sharing stories, insights, and skills from expert voices in and around the United States healthcare world, with a mission to inform, educate, and help healthcare organizations and individuals ranging from one doctor practices to large integrated systems and organizations throughout the dental, medical, and veterinary healthcare industry with risk, while hopefully having some fun along the way. I'm your host, Scott Nelson, a guy that grew up in Ohio and has been working all over the United States during my 20-plus year and counting career in the healthcare industry, with a commitment to accelerating healthcare performance through creativity, not just productivity. Let's dive in. I love plans and lists. There are many reasons to love them. A plan can help with organization and preparation and possibly reduce stress, creating a less hectic environment. I also love history. There are lots of examples of plans in history. Start with the American Revolution and the resolution that created the Declaration of Independence and a plan for Confederation. Unpleasant events such as World War II also require and involve planning that includes risk. Think about the plans and risks involved with D-Day and the Marshall Plan, also known as the European Recovery Program. NASA is a group that is meticulous with planning and checklists and exciting programs like Project Mercury, which was the first U.S. program to put humans in space. The program made 25 flights, 6 of which carried astronauts that not only had to launch, but return to Earth. Now think about the Apollo 13 mission, which became a summer blockbuster film starring Tom Hanks. There was a plan to launch and a plan to return. But an unexpected shock event occurred during the mission that altered everything and everyone involved. Do you have a plan for your healthcare business? Do you have a plan to act if a Houston, we have a problem event happens to your healthcare business? And here are some interesting statistics about strategic planning. Harvard Business School and Harvard Business Review have noted 48% of leaders spend less than a day each month on strategy. 95% of employees don't understand their company strategy, and 60% of organizations don't tie financial budgets to strategic priorities. The Economist noted companies that are poorly aligned with strategy report weaker financial results than their peers. And in a survey of C-level executives, 88% say executing strategic initiatives successfully is essential or very important for their organization's competitiveness. 61% of those executive respondents acknowledge their firms often struggle to bridge the gap between strategy formulation and its day-to-day implementation. How can plans help with risk in healthcare? Planning helps determine risk in order to strengthen vulnerabilities, reduce the likelihood of occurring, and provide a means for better decision-making in order to avoid future risks. A New England Journal of Medicine article about risk in healthcare states having an established plan in place promotes calm and measured response and transparency by staff, and ensures that corrective actions can be implemented and evaluated. I have 2 favorite quotes I will use on occasion during planning sessions. One is attributed to Abraham Lincoln. If I only had an hour to chop down a tree, I would spend the first 45 minutes sharpening my axe. The other is attributed to Benjamin Franklin. If you fail to plan, you are planning to fail. In today's episode, we talk about planning and risk and more with Marc Mertz. Marc is the Chief Strategy Officer at Kaweah Health in California. At Kaweah, some of his numerous responsibilities include strategic planning, business development, marketing and communications, media relations, physician recruitment and relations, and government affairs. The majority of his career was spent consulting with large physician groups and health systems across the U.S. as well as internationally. Prior to joining Kaweah, he was a senior level executive and National Physician Services practice leader with GE Healthcare Partners, where he was responsible for business development, team development, and simultaneous leadership of multiple client engagements. Marc is also a published author and speaker at national conferences. Let's talk with Marc about risk in medical care. Marc, welcome to the show.
Thanks. It's great to be here.
Before we begin talking about risk in healthcare, let's go back to the beginning. How did you get into healthcare and where you are today?
Yeah, so I've actually spent my entire career in healthcare. I actually went to undergraduate school for healthcare administration. Early on, I actually ran physician practices on the East Coast, both primary care and specialty practices, and then spent a vast majority of my career in healthcare consulting, over 20 years, working with health systems and large physician groups really across the country and even a little bit overseas, which was just a fantastic experience. I got to see a lot of different markets. I think I got to work in 43 states and a couple of countries, so I think I got to see a broad perspective of the healthcare industry. And then for the last 5 years now, I've been the chief strategy officer at Kaweah Health, which is an independent health system in the Central Valley of California.
You've been involved in many initiatives at many healthcare organizations across the U.S., like you said, 43 states. I mean, that's very impressive, including your current work as a chief strategy officer and executive. So thinking about risk, how do you define or think about risk in healthcare in your work, both as a chief strategy officer and then also as a healthcare executive?
Yeah, it's an interesting question. As I thought about this topic and preparing for our conversation, I think that we spend a lot more time thinking about risk without actually thinking about the word risk.
Mm-hmm.
I think there's really risk in everything that we do. There's even risk in things that we decide not to do, and then there's certainly risk in doing nothing. And so as I thought about my role in the work that we do, I think risk comes in a number of different flavors. I mean, I think being kind of a hospital guy now, I hear the word risk, I think my mind immediately goes to the kind of actuarial insurance risk, right? You think about capitation and risk models. You also think about kind of the compliance and the risk department, right? Patient safety and things like that. But in my role, obviously, is a big part of it is strategic planning. So there's huge components of risk and what are we focusing on? What are the competitors doing in the market? What's shifting? But then also operational risk. In addition to being the chief strategy officer, obviously I'm also a senior executive at the organization. So all kinds of operational risk, from patient safety and financial risk. The facilities reports to me, and so I'm constantly working with my team to make sure we're having safe environments that don't create unnecessary risk for us. But then as I was thinking about this, perhaps where I spend most of my time these days is an area that I hadn't really thought about before, but it's really reputational risk.
Oh, yeah.
As healthcare providers, it doesn't matter if you're a primary care physician, a surgeon, a dentist, or a health system like we are. We rely and depend so much on having a great reputation with our patients and with our community, perhaps more so than any other industry. That I spend a lot of time talking to the community, looking at data, and just thinking about what is our reputation in the community. What do people think about us? Do they believe we're a safe place to go? Do they believe that they and their family and loved ones are going to get the right service when they come to us? And how do we mitigate that risk, and how do we make improvements in that area? So lots of different aspects to risk. And, again, I think we're constantly weighing risk and trying to respond to it and mitigate it without actually thinking about risk. At least I think I do.
Yeah. And that's really interesting when you brought up the point about the reputational piece of it, which, we hear a lot, and there's a lot of engagement, whether or not it's online, internet, social media. So from a reputational standpoint, it can come from all different ways. How do you approach that from either a reputational perspective or the approach from all of those areas? Because, you're coming across the entire organization.
Yeah. So our marketing team reports to me, which includes our social media team. And so I think years ago, we recognized that no one's going to tell our story like we can. No one knows us the way that we do, and no one is obviously, as vested in telling our story as we ourselves. So you can't rely on the media or others. And so we've taken a very active social media approach to communicate that. And obviously there's a component that's really just kind of informative of these are the services that we offer, these are the locations that we have, and we do all of those things. But more than anything else, we use that platform to help foster that reputation in the community. And we try and highlight the human aspects of the organization. We try and emphasize the quality of care that we deliver, the focus that we spend on patient safety and patient experience, and really creating a safe and healing environment here. And so we spend a ton of time there, as well as just direct outreach with the community. We've got a whole network of community advisory councils, we call them, that there's probably a half dozen different groups that we meet with on a monthly basis to talk about the things that we're doing. And it's really a bi-directional conversation with them to understand what they're hearing, what they're seeing, and what they're thinking about our organization. And that helps us probably stay ahead of some things,
Mm-hmm.
and maybe avoid some risk. And so, yeah, it's a huge component of the work that I do every day.
Yeah. In terms of a planning process, so if you even go to each one of those flavors as you described them, and you think about those in components of a strategic planning process, based on your experiences, how have you formed an approach to address risks from a planning process, thinking about potential components like strategies and tactics and measuring and monitoring, to put those together into one plan that can then potentially address and maybe manage and mitigate or resolve risk even proactively before you come in contact?
Yeah, great question. And my career as a consultant, spent a lot of time working with different organizations to develop their strategic plans, whether again it was a small physician group or a national health system. And oftentimes you found that organizations had a pretty limited planning process. It might be the executive team goes away for a weekend or a retreat, or a smaller group gets together and puts together the strategic plan. And it might be a great plan, but it doesn't have all the different perspectives that it probably should have, and maybe doesn't get the broad distribution and use that it should be. Maybe it sits on a shelf somewhere. And so when I came here to Kaweah Health, we looked at the process that was in place and really completely started from scratch and started over, and developed a strategic planning process that we go through each year. So I'd say our strategic plan is a multi-year plan, but we touch it every single year and kind of revisit it. We don't blow it up and start over every year. We probably do that every 3 years, but each year we really take a close look at it. And it's an extremely comprehensive and an inclusive process. We include our board of directors, which we're a public healthcare district, so we actually have a publicly elected board, but we include all 5 of our board members in the strategic planning process from the very get-go. We include, obviously, leaders from throughout our organization, including frontline staff. And so we probably have, dozens of employees who participate in the plan. We include our medical staff. We invite the entire medical staff of 700 physicians and providers to participate in multiple stages of the planning process.
Oh, wow.
And then we include community members. We invite community members to participate in some of our planning discussions. And while this is a ton of work, as you can imagine, logistically scheduling these different sessions and having these different conversations many times, what you get is you get different perspectives. You get that one community member who just happens to mention something that they saw or thought of that maybe we didn't, because we live it every single day. And that might be just a nugget of a great idea, or makes us think about something risk related that we had not thought about otherwise. And so it just gives us a much, much broader perspective from obviously a lot more people, that I think helps us think around corners and think about different angles and perspectives on issues that we might not otherwise have if we did kind of that smaller executive team get together on a weekend kind of approach.
Thinking about that work and the process of putting everything together, and we've done that, and you mentioned the experience of going through that, and people will go through that process and then potentially at some point maybe put that up on the shelf. When you talk about the challenges and considering all the logistics and the scheduling, when you are involving such a big group of stakeholders or owners, how do you get the buy-in to show folks that, hey, this is a very critical process. This is it's not just necessarily an exercise, but this is something that we're going to take away and get a lot of valuable information, not only, like you said, for today, but over the next 1, 2, and 3 years, to help us in the long run at each one of those levels of the stakeholders and the owners that are engaging with you.
Yeah, I think you have to lay the foundation for people and explain to them what strategic planning is. Again, especially as you're thinking about involving board members who might have, we might have a board member as a school teacher or, a former banker. So they don't necessarily come from a healthcare background. As you think about community members, again, might not have a healthcare background, might not have a big, robust business background. And so I think helping them understand what is strategic planning. We're helping the organization think about the future, think about opportunities, think about threats, risks, and develop a plan that's going to prioritize the most important things we're going to be working on, the things that are most fundamental to our organization's success in the future, that will avoid all of those situations we don't want to find ourselves in. Mm-hmm. And so I think if you help them understand the importance of all of that as a context, it helps them have those conversations and think strategically as opposed to operational. That's another part of it, is really, as I try and work with my team, it's helping them understand there's a strategic plan which is different from operational plans, right? There's things that we do on a day-to-day basis that will never get into the strategic plan, and nor should it.
Right.
So helping them understand those differences is helpful. And also for us these days, in healthcare, resources are not unlimited, right? So you can't do everything. We don't have the time or the staff or the money to do everything. And so as much as a strategic plan is about what we're going to be doing, most important fundamental things to our success, it's also really a lens of what are we not going to be doing in the next year? Because if it's not that important and it can't get in the strategic plan, then we probably don't have the time and the resources to dedicate it to it in the coming year. And so for us, that plan becomes that roadmap of what we're doing, but then also what we're not doing.
From your experiences now, when you talk about just the areas of responsibility you have now, and then the work that you've done prior, and you mentioned today, marketing, strategy, physical plans, some of those pieces, if there were 1, 2, or 3 important actions that healthcare professionals and organizations can and should be doing to decrease vulnerabilities and to strengthen and manage against risk, if there are some specific actions they could do, what should they be doing? And then where should they be focusing those areas? So, thinking about like physical plant, areas around the facility and the actual layout of the organization, wayfinding, things like that. Where would you recommend folks take a look at and tackle first?
Yeah, I guess I'll start broad and then specifically answer the question that you asked. I guess, as I think about what are the most important things we do, and I think we talked about one of them, it's that kind of comprehensive planning process involving as many people as you can, different perspectives, to see just different things or see things differently than you might is important. Second, I find that having a good network of colleagues outside of my organization that I can reach out to and talk about the things that they're seeing in their markets, the things that they're seeing in their organizations, can be a good way to think about things that I wouldn't have otherwise looked at. And then also, trying to put myself into other organizations' shoes, and especially as I think about competitive risk. If I were, the system across town, how would I be looking at the market? How would I be looking at opportunities to align with physicians? Or where, if I'm looking at my organization from the outside, where are the weaknesses in my organization that if I were in, someone else's shoes for the competitor, what would I be targeting? What would I be trying to do to counter our efforts? And so that's all helpful. Specifically about, some of the more physical plants, nothing can beat walking around. And so on a regular basis, I meet with my director of facilities all the time, but on a regular basis, we've got scheduled blocks of time, and it's usually a couple hours where we'll just go out and walk. We'll walk the floors of the hospital. We'll walk some of our outpatient buildings and facilities and just look around. And is the environment clean? Is it safe? Talk to the teams, get their perspectives on the facilities. And again, is it safe? Are there other challenges? And, nothing beats going out and putting your eyes on things and trying to witness it firsthand.
And then when you're doing that, are there specific metrics that you're monitoring on a regular basis? Are there specific resources that you've found to be helpful or be successful for when you are engaging in all these different activities?
Yeah, for facilities, obviously preventative maintenance. There's indicators on whether it's an HVAC system or anything else, in trying to keep up on all those PMs and make sure that we're doing the preventive work so that we don't, get into an unfortunate situation. But beyond that, I think it's just talking to the people, both from the facilities team as well as just the operational folks out there. They know when there's an environment that's unsafe, right? They can see when something's not working, or they hear something from patients. And often it's just asking that simple question of, is there anything in this environment that you feel is unsafe for you or for the patients that you're caring for? And people will tell you, these people work 8, 10, 12 hours in these environments. I might just be walking through for 30 minutes. So, ask the folks who live there and work there and really know that environment better than I'm ever going to know it.
Do you see risk variations among the different departments, among the geography, both internally within the system and then outside within the community? Are there different risk variations or variabilities within each of those areas that you have to work within?
Yeah, no, I think there can be huge variation in all of those things that you mentioned. And you think about, internally for a moment, you think about different departments. There's one level of risk in the operating room, or let's say we do a lot of heart surgery. So The cardiothoracic surgery OR is one level of risk, or you go into the finance department, right? Completely different level and type of risk there. And so, different levels of awareness and risk mitigation and emphasis on facilities, absolutely. Organizations, for sure. I mean, running a hospital these days in the state of California is not for the faint of heart. It's an expensive place to live and to operate. The state, it seems like continues to roll out these unfunded mandates on us. So it can be very challenging here. Finances, especially post-pandemic, are a huge issue for us. We're an independent health system. I mentioned before, we're a public health system. 60% of our population in this community is on Medi-Cal, which is what California calls Medicaid. So a very challenging payer mix that creates an environment of risk for us in this community that, let's say, a hospital in Huntington Beach or Beverly Hills with a very different payer mix, maybe a very different organizational structure and financial stability and security, might have obviously a very completely different level of risk in the current environment. And so I think it comes down to the organization, but also geography. Different communities, different states, different areas, I think can be highly variable in really probably all aspects of risk. Certainly from a competitive standpoint, right? Very different competitive levels. You go to Los Angeles, there's 90 plus hospitals. I'm in Visalia, there's one hospital. Mm-hmm. So, the risk of the hospital across the street moving into one of my service lines and taking that volume is much lower here. And so, variability in the types and the acuity level of risk, whether it's within the organization, between organizations, or certainly in geography.
You mentioned you're in California and some of the things that are happening within California locally, but then around the state. Looking back through recent history at Kaweah, from a risk standpoint, what can you take a look at and think about that was expected versus unexpected? What could have been done differently if you had, with the advantage of hindsight and being able to plan and prepare going forward?
Yeah, I think we ask ourselves that question a lot, especially with the COVID pandemic, and the last 3 years have been fairly unique. And so I think we reacted and responded as best we could in the heat of the situation. And there's the clinical aspect to it, there's the financial aspect to it, there's huge issues operationally with staffing and otherwise. And so I think we did a fairly good, or maybe a very good job of navigating that. When you really didn't know what to expect. I mean, every day it was something new, right? Mm-hmm. With the disease and with the way that the state and the federal government responded to it. What I didn't anticipate, and perhaps we didn't anticipate, is that as the pandemic clinically declined, and we had at one point nearly 200 COVID positive patients in the hospital. We're down, we might see 4 or 5 a day now. So it's essentially that the clinical aspect of it is really, for the most part, over here. But what we didn't anticipate is really the aftermath of the pandemic was greater, perhaps, than the pandemic itself. And you think about the inflationary pressures that we're seeing, and I think everyone is seeing these days. Labor costs more, medications cost more, equipment costs more, energy costs more. Everything just costs so much more than it did. And that, especially the staffing part, was so unexpected. We lost so many nurses during the pandemic, nurses that either left the state, left the industry, retired, or went into travel nursing, that, we struggle every day now to staff the hospital. And that is surprising that it's a bigger issue after COVID than it was even during COVID. Mm-hmm. Yeah. And I don't know that we could have foreseen it, but to answer your question, what didn't we see coming as a risk? That inflation and especially the staffing challenges were probably the biggest unexpected risks that snuck up on us.
Well, you mentioned inflation and you mentioned some of those expenses. Now that we've been dealing with those for a period of time now, and that things may be taking place towards the future, looking forward, either during this year and maybe even beyond, factoring in some of those things about labor, overhead expenses, supplies, workforce, with your nurses, what approach have you taken based on those lessons learned over the COVID period that you're applying and then moving forward with and learning from there?
Yeah, another good question. On the supply side, we do participate in a group purchasing organization, and so I think pressuring them to be more aggressive in their efforts, as well as our own buyers, working with our vendors, shopping around more than we ever did before. Part of it's just to find stuff, right? Just getting things through, in the supply chain has been challenging. Just the stocks haven't been there, and so trying to find the things we need, but then also shopping around pricing more than we ever did in the past. On the supplies, it has been vital. The staffing, we've had to get extremely creative to the point that we started our own nursing school this year. And so in February, we actually sat our first cohort of registered nurse students. And so I think 25 new students joined the program. They're working part-time for us. They've got full-time benefits, and then they go to school part-time. And the nursing school is in our administrative building. So they're going to class in our administrative buildings. They're doing their clinical rotations inside the hospital. And when they finish, and it's either a 2-year or a 3-year program, depending upon what courses they have already completed, they then just owe us 3 years of service because we've heavily subsidized the program. So we just couldn't rely on the normal pipeline of nurses coming out of schools across the state or in our community to meet the needs of our organization. And so we had to go out and create our own nursing school, which is not something we had seen on the radar, but we have high hopes that although it's not going to solve it tomorrow, 2 or 3 years from now, we feel confident that we'll have a pipeline of nurses that we know well, that we've trained, and they've hopefully got an attachment and a commitment to this community and this organization that's going to result in them staying here for a long time to come.
That is absolutely an example of taking a creative solution and approach to solving a problem. The last question goes back to geography. You mentioned geography earlier, and as having lived on both coasts and worked in 43 states, taking a broad national view, what do you see as the biggest challenges we are facing in the U.S. healthcare industry today related to risk? What could and should be done to either be prepared, address and manage, or even resolve before it even hits us?
That's the $10 million question, isn't it? Well, I think we already talked about the fact that risk is variable. It's variable by the organization, by the geography. It's certainly variable by what you do, the type of provider that you are, the type of services that you're providing. So I think there's all kinds of different risks out there. But I think across all of those areas, I think as healthcare providers, we always have the kind of compliance risk. We need to deliver safe and effective care to our patients, whoever they are, and take steps to ensure that we are doing that every time. You can't. It's not enough to do it most of the time, right? We have to do it all of the time. And so, looking at the systems and the processes and the approaches that we take to make sure it is, the safest and the most effective way to do things, and constantly reevaluating that and spending the time to proactively think about those things, thinking about what is the next way that one of my patients could be harmed, and engaging your staff and other providers in thinking about that question and answering that question so that you're ahead of any potential risks and concerns is vital. I go back to the reputational risk, and again, I think other industries can compete on price or on features or functions. We trade on our reputation for the most part. Certainly, location comes into play and potentially services, but at the end of the day, patients come to us because they believe that we're the best person to care for them, or we're the best organization to care for them. So how do we foster that relationship and that trust among our patients is vital. Because if you don't do that, you talk about risk. If you don't have that reputation, you risk existence. And then in environments are different types of risk. We talked about a lot of California risks for us. I'm sure each market that everyone's in has their own inherent risks there. And so just thinking about their own particular situations. And going back to, I think, having that comprehensive approach that allows you to really evaluate all of those different areas. I would encourage everybody to think about what you're doing on a kind of semi-regular basis, but also on an annual basis to really assess where your organization is, where is it that you want to go, but then really spending time thinking about what are the risks, what are the threats that are out there, whether it's a competitor across the street, whether it's some of the government policies. And we spend a lot of time thinking about government policies because 80% of our money comes from the government, whether it's the state or the federal government. So we're constantly thinking about what are they doing to change, what's changing in your industry. What do you need to be thinking about 6 months, 12 months, 18 months from now to hopefully make sure that your organization is in a better place than it otherwise would have been.
That's a great point to conclude our conversation. Marc, thank you very much for your time and sharing your thoughts and experiences today. We really appreciate it.
Yeah, Scott, it was a lot of fun. I appreciate it.
Thank you for listening to the Risky Healthcare Business Podcast. You can listen to all episodes from the Resource Center page of the SpringParker website, springparker.com, or click the listen link in the show notes to listen and subscribe for free on your platform of choice. And remember, accelerating healthcare performance is achieved through creativity, not just productivity.